I always have to add that I also had 4 kids in 5 years. I promise this is not going to be a depressing talk. You're going to leave feeling very hopeful, though I'm talking about a depressing subject. So, suicide is one of the world's most major public health crises. It's a leading cause of death across the world, across ages, every 40 seconds across the globe, every 13 minutes in the United States. Nearly 1 million people die, 25 million people a year try to end their lives. It accounts for more deaths than war, homicide, and natural disasters combined. Did you know that it's actually the #1 cause of death among adolescent girls across the globe? #1. It is the second leading cause of death in 10 to 24-year-olds in the United States. And if you take the precursors, did you know that when the CDC does studies of your average high schooler across the nation, almost 10% say they've tried to take their life in the past year? And these are non-depressed, non-disadvantaged, and we know those are gross underestimates before we've had any comprehensive monitoring. So that means in any typical classroom, 3 students will have done that in the past year, and it's probably double that number. It kills more people than car crashes in the United States. #1 cause of injury mortality. Again, for every depressing statistic, I have a hopeful solution. And it's just this global mental health crisis. You know, depression is the most debilitating disease in the world in middle and high income countries, soon to be everywhere. Costs humanity more than anything. And you know what? Nobody, it doesn't discriminate. We are all vulnerable. 6 in 10 women, 4 in 10 men, cuts across age, race, sex, religion, or income. And literally, you all know this. Suicide touches everybody. There's not a person that doesn't have a story. It actually, 135 people are affected for every death. And these effects linger across generations because of the silence and the stigma that often follows. Here's a very alarming perspective that I need to give you. Do you know that the CDC has told us that our life expectancy is actually going down? We are the only developed nation in the whole world where it's not going up, okay? And we don't have cures for cancer or heart disease, but we do know that suicide, which contributes to this, is preventable. It is our one preventable cause of death. And what's happened is that we've made tremendous progress for other diseases that have reduced by 50%, AIDS, heart disease, leukemia, but we haven't touched suicide. In fact, it's gone up. Why is that? Because of stigma, because of a lack of easy way to identify people who are at risk and need help. And also, depression and suicide are the most devastatingly under-recognized and underfunded diseases. Remember, costs humanity more than anything. We don't spend anything to fix it. And that's a devastating, the head of NIMH said, the under-recognized public health crisis of suicide. We also know that nearly 50% of people who die by suicide have seen their primary care doctor the month before they die. We should be asking these questions the way we monitor for blood pressure. Do you know that many adolescents who've tried to take their life and show up at the emergency department are not there for psychiatric reasons? If we're not asking everybody, we're not going to find the people that we need to. And what's been really striking to me in this work is how it's a crisis everywhere we look. Did you know that very often it's the #1 cause of death among police themselves? So we work with police not only as first responders, but they want to be trained to recognize these signs in their partners. Get this, if you take a large corporation of 100,000 employees, every 6 days, an employee or a family member will die by suicide. Every 6 days. In New York, we lost more people to suicide in the employee assistance program than in the inpatient psychiatric hospitals. So what this shows us is that we just really need to be asking and finding everywhere, caring for the caretakers. And there's massive, massive economic burden. And when you're talking about saving lives, it's not about money. But if we're throwing the money in all the wrong directions, we can't do what we need to do to help and save lives. So $141 billion a year suicide costs in years of life disabled or lost. In 2006, $57.5 billion for mental health care in the US, equivalent to cancer care, $2.5 trillion globally, and expected to increase to $6 trillion by 2030. And we know that depression is the #1 cause of work-related absences, okay? So let's screen. Happy employees actually equal healthy earnings. We know that 45 to 90% of the cost of depression treatment could be offset by gains in work productivity. So it helps everybody. Okay, here's a question. Suicide is a choice, a sign of psychological weakness, akin to murder, akin to cancer, or all of the above? Anybody? All of the above. Exactly the problem. We have to break down walls of stigma and misunderstanding. Suicide is not a choice. Its biggest cause, a heritable, treatable medical illness called depression, like cancer, but you'd never hear the word choice when it comes to cancer, would you? This is a brain-based illness. So we know that 90% of people who die by suicide have a treatable mental illness, most often of which is depression. So when I had the great fortune to give a speech to the leaders of the European Union on how to fight this, I said, you know, you can put up barriers on bridges and do other important things, but if you really want to maximize impact, it's about treatment and identification. Okay, here's another question. How many people think antidepressant medications can cause someone to be suicidal? Okay, guess what? Absolutely not. And guess what? I'm the person that was commissioned by the FDA to get interpretable data, so there's probably nobody that knows the answer to that question as well as I do. It's actually the opposite. We know that antidepressants save lives, okay? Since we have modern antidepressants, Paxil, Prozac, serotonin reuptake inhibitors, the suicide rate has dropped dramatically across the world, across ages, reversing a trend prior to their introduction. Lots and lots of great science showing that. But when all these controversies and misunderstandings happened that were based on everything but science, because I was the scientist involved in that, what ended up happening, guess what? Prescription rates plummeted, and guess what? Suicide rates went up again. Not only did suicide rates go up, the diagnosis of depression plummeted to levels we hadn't seen in 10 years. Because if you can't treat, you probably don't want to identify. We know that not treating depression is what kills people. This is new out from the CDC. Autopsy studies always show us the same thing, that people who die by suicide don't have medication in their systems. And you know what? This is also breaking news from the National Institute on Drug Abuse. Not surprising news, though, that we all read about overdoses, right? We're reading about it every day in the press, that opioids are a significant amount of suicide fatalities. Because you know what people do when they're drinking or taking opioids or drugs? They're trying to self-medicate. They're trying to deal with the unbearable pain in ways that aren't healthy. They don't have appropriate treatment. So these things are incredibly connected. So we know that treatment is one of the most important answers, but unfortunately, most people who need treatment do not get it. 50 to 75% of those in need receive no treatment or inadequate treatment. So when the study came out that antidepressants are the #1 prescription in the country, this is what I said. That's encouraging. We worry more about under-treatment than over-treatment. And then what are the other barriers to treatment and prevention? This stigma, you know, real men don't get depressed. So this is a firefighter, right? It's the stigma attached to admitting that you have this problem that gets in the way of beating depression. You know, we know that men die by suicide more often than women, and we've thought traditionally in the field that that's because they choose more effective, more painful methods. But my colleague with the CDC has done some really important work and found that only 11% of male suicides have antidepressants in their system versus 41% in women. You know what that means? Men probably don't want to go ask for help. They don't want to get the help that they need. And this stigma can really kill. So I was just flown out to train all the pilots and flight attendants on the method of identification at one of the major airlines. And you know, pilots are part of the community. They have biology. They suffer from depression. It used to be 5 years ago, you could not be depressed and fly. You lost your license. Now we're making progress. There's a list of 5 things that they can. This is my friend and colleague who is a suicide survivor. Her husband died by suicide. And he was a Marine, and he was depressed. And he went to his commanding officer, and he said, you know, buddy, I've been there. But whatever you do, don't go on treatment, don't go on medication, because you can't do that and fly. And he's now not alive anymore. We must get over this stigma. And we've realized, you know, in the US Army, it used to be that you go to another building to get treatment. People didn't want to go there because it was stigmatizing. Now they've brought it centrally, and it's helped them reduce the suicide rate. Okay, suicide can be prevented. Never in those truly intent on suicide, sometimes, but only in advance of acute risk, always, but only in advance of acute risk, or always, even up to the last minute. D, exactly right. See, we're making progress. Identification is the first key to saving lives. If we can't find people suffering in silence, we can't help them. So my work that was referenced is this science to service story, a few simple questions to save a life that identify people who need help and get them to the care that they need. And you're going to hear from my friend Kevin Hines in a few minutes, who survived jumping off the Golden Gate Bridge. And he will tell you that he said if just one person had asked him if he was okay, he wouldn't have done it. Most people considering suicide want someone to save them. What we need is a culture in which no one is afraid to ask. So what is the power of asking? So since we implemented these questions in the largest community behavioral health provider in the United States, in Tennessee, they reduced their suicide rate by 65% in the first 20 months. And they brought it to life by telling a story about a man who they called a few times, and he said he was fine. He said, the last time you called me and asked me those questions, I was on the bridge. The unbelievable potency of being able to ask. And one of the really important things is that everyone everywhere can ask, and that's part of what we need to do to save lives. I went to train a Hindu temple in upstate New York, trained the priests and the grandmothers and the grandfathers and the high school kids, and 2 weeks later, there was an article in the newspaper, this grandma who couldn't read, her grandson walked in, didn't look very good. She asked the questions, and it said probably saved his life. I just went to Princeton the other day, trained the athletic coaches and the resident advisors and the security. You know, there was a community member here, a boy said to his friends, I'm going to kill myself after the lacrosse game tonight, which is exactly what he did. But nobody knew to take it seriously. I went to this big hospital, said, you know, we trained the janitors. And this clinician from the VA said, exactly right. I'll never forget that case where the only person that vet spoke to was the janitor. Doesn't mean he's ever going to need to do this, but he'll be prepared to. Parents are using it to save kids' lives. So we've learned, this is a very important memo from the Undersecretary of Defense, to say we must go beyond the medical model. We must put questions in everybody's hands. So guess what? The Marines, they trained all support workers, clergy, legal assistants. That helped them achieve a 22% reduction in the rate of suicide. And that's what every community can look like. So 48 states have gone top down. This is what the Air Force looked like. So now every spouse will have the cards, every airman, every kid, so that Kim Ruoko doesn't need to lose her husband, perhaps. She said, if only I'd had those questions, I would have known not to leave him alive. And really, hot off the presses, since asking and doing this approach, Utah reduced their state suicide rate for the first time in 10 years, reversing an alarming upward trend over the past 10 years. But Utah's one state, right? We can be doing this everywhere, and that's really important. Now, what does this mean? The power of asking, we heard about the Deputy Secretary. This could actually help address one of our nation's most major crises. You know, we've had over 1,000 mass shootings since Sandy Hook alone, okay? Over 1,000. And we also know, however, that up to 90% of shooters have suicidal issues. So if we ask a few questions, maybe we can find them before it's too late. And that's why he said we can keep all of these children safe. And we've been working with the NRA and the gun community so that everybody can be asked. You know that guy who goes up to the gun shop counter, does not want to die, does not know that there's help? And we can be asking these questions. You know, 2/3 of gun deaths are suicide. But we can begin to prevent this. So that it's a really important thing. You know, when I was talking about this, and Jim was quoted, Shelton, the Orlando hostage negotiators saw me at the tail end and brought me down to train the hostage negotiators the week of Orlando, which was really powerful. And you know, a large portion of hostage takers are suicidal. So they said the same thing. We need this to save our own lives. We need this to prevent these devastations. And you know why this story is important, or people like it, is because it cuts across all the impasse of gun control, right? There's nobody on either side of the aisle that doesn't get the simplicity of that. And we know that when we just ask, we break the silence. We give permission to connect and build a path to openness and resilience across generations. And Israel, the country of Israel, who every school teacher in Israel has these questions in their pocket, and everybody else. And they said, it's not only saving millions of lives, it's literally changing the way they live their lives, breaking down barriers that have been built up over thousands of years. So now the third generation Holocaust survivor who never had a voice does. The Israeli provider is talking to the Arab child. But they said, we're just one nation, and every nation deserves to have this. You know, and that's what you talked about, 1 person and 300. Everybody in this room can take this and save many lives, and Aspen is only the beginning. There's a whole world out there. Because when we work together as a community to identify, to understand that we can do this and to break down these barriers, we can actually together achieve a world without this horribly tragic, unnecessary loss of life. So when communities come together, there's hope, and we're seeing that every day. So thank you very much for your attention. And outside, there are tons of ACE cards and flashlights and brochures for the questions and